On behalf of RSNA, thank you all for attending today. My name is Mary Mahoney. I'm the Benjamin Felson Endowed Chair of Radiology at the University of Cincinnati. And I'm also the President-elect and Secretary-Treasurer for the Board of Directors for RSNA. And as we work together to cope and address the many issues that COVID-19 has presented to us, I want to let you know that this webinar is one of the many ways that RSNA is trying to reach the radiology community and provide education and resources to address coronavirus. You can find these resources on the coronavirus and COVID-19 section of the RSNA website, and we're updating it very frequently, sometimes daily, with new information as it presents. And there will be a link to this page that will be provided in the chat and the resources panel that you should see at the left of your screen. We have a terrific panel lined up for you today, and I've reviewed some of the responses that many of you have sent in from the questions that we posed on social media. And looking at the various topics and issues that you've raised, I think this is going to prove to be a very interesting and engaging session. So with that, I'm going to go ahead and get us started with the faculty. And first, I'd like to introduce Dr. Mahmud Mossa-Basha. He'll be speaking first, and he'll be moderating today's session. So thanks again for joining today. And Dr. Mossa-Basha, I'm going to turn it over to you now.
Thank you so much, Dr. Mahoney, for the introduction. Before we get started, there are a few things to let you know. You may follow the steps on the screen to claim 1 CME credit for this webinar. Instructions on how to claim CME are also found in the resources panel and in an email sent after the webinar. Here are the relevant disclosure and accreditation and designation statements. And here is the RSNA disclaimer. Now, please use the questions panel to submit your questions during the webinar. This webinar is being recorded and will be posted on RSNA's YouTube page within about 1 business day after this event. With us today, we have Dr. Janet Bailey. Dr. Bailey is the current chair of the ACGME Radiology Residency Review Committee. She's the past president of APDR and AUR, and served as program director of the Diagnostic Radiology Residency at the University of Michigan for 13 years until 2017. She's our first speaker. Also speaking today is Dr. Harpreet Bedi. Dr. Bedi is the current associate vice chairman of radiology education at Boston University Radiology and the Neuroradiology Fellowship Director. Dr. Bedi's professional interests have centered around education and radiology. He is the current chairperson for the RSNA Education Study Section, the APDR Education Committee, and the ACR Learning Design Committee. And speaking last will be Dr. Dania Day. Dr. Day is an interventional radiology fellow at Massachusetts General Hospital and is a clinical fellow at Harvard Medical School. She completed her radiology residency at MGH and is an incoming faculty member in interventional radiology at MGH starting this summer. Dr. Day currently serves on the RSNA Resident and Fellows Committee and was recently deployed to the medical wards to care for COVID-19 patients. There will be time for Q&A at the end, so please submit your questions. And now our first speaker is Dr. Bailey.
Thank you, Mahmud. Hi, everybody, and welcome to the webinar. Okay, so I have quite a few slides, but I'm going to try to go through them relatively quickly. The idea being to get through a lot of material that pertains to what's happening during COVID that has been dealt with all the leadership in radiology education. My chairmanship of the RRC is with this group here. You can see the members represent all the different specialties, and thank you to our committee for all their hard work. This is where people are from on the committee. It's in red, and so you can see we're from all over the map of America. This is what COVID-19 looked like as of last week in terms of number of cases. So if you compare the two maps, you can kind of see that the Residency Review Committee people are from sort of some of the areas that are hard hit, like New York, Michigan, where I'm from, and then others that are less hard hit, a little bit more in the middle of the country. So we have seen all different things. The ACGME, the larger organization, developed a pandemic status strategy So if a hospital or health system was hit really, really hard, they would get all the way to stage 3 pandemic emergency status, meaning that basically everything goes to fighting coronavirus and education is largely suspended with some major rules like supervision and the demand for PPE and everything still intact. So a number of hospitals are in either stage 2 or stage 3 pandemic. So what did Radiology Review Committee do for COVID, specifically for radiology residencies? What we looked at was what was happening across the country, and the major hit was clinical volume. Many health systems largely shut down, so there was reduction of volume. Residents were sent home to work remotely, and a few residents were actually deployed to non-radiology assignments. So these are the areas that we touched on, and while I am going to go through this quickly, the slides will be available later. So the first thing was extension of training. If you've lost volume clinically, is it possible that a resident will be not sufficiently trained and they may have to extend their training? This is not an impossible scenario. If something like that happens, it's a determination of your program director. The Clinical Competence Committee will help. The ABR then will certify individual radiologists after they've graduated from residency, and the ACGME itself is involved in programs and really is not involved in the individual trainees. So this is a program director issue, and it could happen. The other thing that people are really worried about is case logs. ACGME has case log minimums, and they're designed to really monitor programs again to make sure that there are enough cases and variety of cases for trainees in a given program of a certain number of residents. So we can't really waive that during the pandemic. However, people know that it's a tough time, and if somebody is in pandemic status and they indicate that in the major changes of their program in the ADS system of ACGME, the RRC will take that into consideration. So I think it's going to be a lenient scenario. A couple of areas of radiology are governed by the federal government. So the breast imaging rotations are one of those. The FDA says we have to have 12 weeks. If your department wants to do that via telemedicine, it's fine. There have to be 60 hours of didactics. That can be done virtually. And for residents who are in their senior year and want to graduate and need their 240 mammograms, if they have to, they can look at already finalized mammograms in blinded fashion and be supervised on those. So these are modifications we made for the pandemic. Nuclear medicine is a similar area, also governed by the federal government. The 700 hours can be done by telemedicine if the AU in your department agrees to it. The 80 hours of classroom and laboratory training have to be done, and part of that must be done in person. So we can't get around that. The I-131 therapies, if you can't get them done during your residency, the ABR has agreed along with the RRC that we will allow postgraduate documentation if that's necessary for a senior. ESIR is another curriculum people were worried about. How will I get my ESIR residents into all the IR training that they need with the pandemic shutting down things? If you need to move your block schedule around, that's totally fine. It's possible a resident won't finish all their 500 cases and they can still enter the IR residency, no problem. However, by the end of IR training in the independent residency, you still have to get your total of 1,000 cases. Another requirement in ESIR is the ICU requirement. And this is an important requirement for training, but if you can't get it done, you may have to defer it to your interventional residency, and you have to fill out some paperwork to make sure that happens. However, if, for example, an ESIR resident gets actually deployed to an ICU rotation, they can do that and it will count towards the requirement. So those are the rules changes that we published on the website, and those are available at ACGME. One thing we didn't address was AIRP, and a lot of questions have come up about that. This is what the rules say. It says a resident must demonstrate knowledge of radiologic pathologic correlation. AIRP is a popular way to meet that requirement, but there may be some barriers to going this year. Some people may not have discretionary spending anymore. There may be issues with social distancing and health concerns. The AIRP has offered a virtual course starting in July, so that may answer some of it. In general, though, not all programs send their residents to AIRP, even in non-COVID times. So if it happens that you cannot go to AIRP, there are other acceptable ways to the RRC. You might participate in tumor boards or develop a course with pathology, that kind of thing. So there are other options. This is a slide I just included, and I'm just going to point out this is not my door, but a friend of mine left her wreath up for the entire, it's up in May right now, and a little house finch is nested in it. It's very cute. Okay, the next thing that's come up a lot is the American Board of Radiology exams. Obviously, there's a lot of consternation about that. Just point of clarity, I'm not from the ABR, but I do have some familiarity, and I reached out to them this week to make sure I understood what was happening. So this is the exam schedule as of April 7th that they published on their website. Exams are scheduled for October and November in both sites except for the IRDR, which is oral, that will only be in Tucson. So they have said we pledge to remain flexible and responsive to candidate needs. They are fully admitting that there's contingency planning complications. Each state has different rules on meeting and travel. Health systems and universities have different rules on travel. And then there's the virus itself. We don't really know what's going to happen. So it is a moving target. And I appreciate people are frustrated by the fact that it's a moving target, but I do believe the ABR is doing its best. Another big topic that I wanted to talk about is residency selection. So there have been a lot of concerns about this with pandemic, and we're expecting a second wave. The health professionals believe there will be a second wave. So there are concerns about the safety of traditional in-person interviewing. This came up as early as March. People were aware right away. So there's a group called the Coalition for Physician Accountability, and they formed a work group. I had really never heard of this before, but it's all these organizations. You see their logos at the bottom. A subgroup of all the players like ACGME, NRMP, AAMC, et cetera, all got together to come up with some guidelines. And here's what they came up with. Recommendation number 1, and this was published last week, and you can see there's a web address down there. Away rotations are discouraged for medical students. A couple exceptions, if it's a graduation requirement, or say you're going into neurosurgery and you have to do a rotation in medical school to even apply to that residency, you will be allowed to do an away rotation. But it's going to be very restricted at most med schools. Recommendation number 2, virtual interviews. They want all programs to commit to online interviews and virtual visits for all applicants, including local students, rather than in-person interviews for the entire cycle. So if the pandemic is bad early in the cycle, but it gets better later in the cycle, they don't want you to change midstream, and they don't want you to give special treatment to local students. Number 3 is the ARS opening, and I had a slight typo on here. They recommended delaying opening of ARS, and ARS has done that. They're now opening October 21st. The typo is they usually open on September 15th. But this is the Dean's letter is usually out October 1st. That's going to be delayed to October 21st at most med schools. And the final recommendation is that everybody talk to each other and get along with each other and play fair with each other, et cetera. The guidance is intended to add but not supersede the independent judgment of all the schools and sponsoring institutions and residency programs. And because students rely on these predictable practices, they really are encouraging us all to have a shared response to the disruptions caused by COVID-19. And I've clarified as recently as last night in a phone call that there is no way to enforce this unless the NRMP or some other organization intends to do so. So this is on good faith at this point. Thank you for your attention. I really appreciate it.
Thank you, Dr. Bailey. And thank you to the RSNA for the invitation. Mahmud, thanks so much, and to be part of a great panel. I really appreciate it. My role is to talk a little bit more about residency and residency education and some of the resources during the COVID crisis. We'll be addressing the impact of COVID-19 on radiology education, some of the initiatives that have been taken to address educational needs, and some of the future potential during the crisis. So, as all of you are acutely aware, there are no more in-person anything, educational conferences, readouts, multidisciplinary conferences, M&M, research meetings, grand rounds, mentorship meetings, program director meetings. All of these are being done in some remote fashion. And it has taken a toll on our way to communicate and be connected. And I do believe it has taken a relatively isolating profession like radiology and put that isolation on steroids to some degree. And that takes a toll on your well-being. And I think we all have to acknowledge and respect the fact that so many of our residents are feeling an increased sense of isolation during the COVID crisis, especially with everything being done remote. And not only that, the issue of the fear of being sick, family members being sick. Residents can't go to the gym and exercise as a decompression from the stress. Many live far away from their families. Many are not able to connect with their support groups that they normally would. Clearly, there's a fear of testing, as Dr. Bailey just said, and future careers. So there's a lot of anxiety out there and a lot of fear out there, and I think that has to be acknowledged. Now, when we talk about education, oftentimes our educations are very structured in undergrad and medical school, and our curricula are on learning management systems. And when we get to residency, sometimes it's sort of the Wild West from a structured standpoint. And this has made it even more unstructured for many of the residents that have a relatively unstructured experience already. Oftentimes we hear, what are we supposed to read on this rotation? Now we're also hearing things like, what are we supposed to watch on this rotation? There's so much content out there, and how do we vet that content, and how do we deliver it in some structured manner? Very important. And again, the anxiety of, is my participation in these online resources going to be documented in any way, and how am I going to do that? So again, a lot of issues there. So some of the initiatives we're all, I don't know if any of you have heard of this thing called Zoom. It's out there now, but so everything, it's out there. All the web conferencing platforms, Zoom, Google platforms, Microsoft Teams, WebEx, and everything is being done online now. In the education space, it's local education, national, international education, guest lectures. People are utilizing web conferencing for journal clubs and interesting case conferences and grand rounds. So all the multidisciplinary conferences and even resident wellness is being done on over platforms. And again, Dr. Bailey addressed several of these issues already with remote radiology residency interviews, virtual medical student rotations. There's a lot of institutions out there that are starting to get these very creative ways to do virtual medical student rotations. The question, a lot more questions and answers in a lot of ways, but will we continue to train residents with a partially virtual experience? And in the future, should residents actually learn to train and teach in a virtual environment if we're expecting them to do that as attendings moving forward? So maybe actually training residents to teach remotely should be part of what we do in the curriculum. I do want to mention this YouTube video by Dr. Nagier. It's called Teaching at the Workstation Remotely, How I Do It. She has spent a large part of her career actually practicing remotely and has won teaching awards for Johns Hopkins, and she put this YouTube video up. I think it's a really good resource to give you some real nice tools on how to teach remotely from the workstation. She's been very successful at it. Other really great resources, if you are on social media and Twitter, if you hashtag FOAMRAD, which is free open access medication, Meducation radiology, you're going to get a lot of crowdsourced resources that are out there for some of the best free online content. So that is something I would absolutely advise people to do. If you're not on Twitter, it's a good resource for education. And if you just use the hashtag FOAMRAD, you're going to see crowdsourcing from ACUBE, CR Squared, and ACR Resident Fellow section on a lot of the great resources. If you're not on social media, the Association of Program Directors in Radiology has a website that has tried to get centralized resources for people. Clearly, the RSNA has resources that are plentiful, many of which include the COVID-19 sources and many of the other sub-societies as well. So there's a lot of people out there doing great things. Having said that, you can clearly experience Zoom fatigue doing all this, but manage your time wisely and you should be good. So finally, what does the future hold for us? I sort of think of this in a few ways. So will in-person meetings be more interactive? So if we're going to get back to a space in which we are going to meet together, those spaces better be worth, and those sessions better be worth getting together in that way. So they should be interactive. They should be taking deeper dives and critical thinking, because if we're just going to meet again for a data dump, we know now that we can do that remotely really, really well. So it makes in-person meetings slightly higher stake. What does this mean for national meetings? What does this mean for AIRP? I think that is yet to be determined in many ways. Again, is there a place now in the future for blended curriculum and flipped classrooms? Is there going to be more live streaming conferences, more live streaming visiting professors and grand rounds? If we think about it, it sort of evens the playing field with programs that have fewer resources. They can now hear national speakers remotely. It also levels the playing field to some degree for international programs that have fewer resources, and that levels the playing field. Because listen, in the end, we all know the bottom line is to take better care of people as best as we can, and we should be leveraging technology and all of our resources to help people around the world do that. So I think there's an opportunity in the future, certainly. So again, well, residents want more clinical experience because of redeployment, and I think Dr. Day will probably address that. We've had a lot of great feedback from residents from being redeployed, and some of them sort of wish they had a little bit more clinical experience in their residencies. And again, well, we have residents being trained to teach and learn remotely. So a couple last slides here. What are people looking for? I think communication is key, and the best leaders are communicating appropriately. Be flexible with your residents, be flexible with your expectations, be optimistic in this time with your residents. It's very important. Show that support and try to provide some structure. Set reasonable expectations, engage and empower your learners. I think residents have the ability to be creative, especially in these times, and engaging them will bring ideas that we may not have as faculty. I listened to a wellness app the other day, and they showed one characteristic that people in the pandemic hold that are doing better than others, and that was what they call a flow activity. What is a flow activity? It's an activity that transcends, it goes through the days and it builds. It's almost like a goal. So if you can find an activity that you're building towards, you tend to do better during the pandemic. So something to think about is thinking of a flow activity, and taking care of yourself is of the utmost importance here. So I'm sure there's more out there. I know this is brief. I would love to hear more from you if you have comments or questions. I am on Twitter, or you can email me. And again, I thank you for the opportunity to present here at the RSNA. And our next speaker will be Daniel Day from Mass General.
Thank you, Dr. Bedi, and thank you to RSNA and Dr. Mossa-Basha for the invitation to speak today. My role today in this presentation is to talk about the resident and fellows perspective and training during the COVID-19 pandemic. I think there is no doubt that radiology trainees are now adapting to a new normal. I think Dr. Bedi and Dr. Bailey covered this in their presentations, but there is a huge decrease in case volumes and change in the case mix that we're seeing as trainees. Most of the readouts are now happening remotely, and I'll talk a little bit more in detail about that in the next few slides. Also, as Dr. Reddy mentioned, there has been redeployment of many trainees to the COVID units. I was actually one of those trainees a few weeks ago. And there is also huge disruption to fellowship and job interviews and board exams that I'm sure many of the people taking boards this year are anxious about. So to focus a little bit more about the effect and impact on trainee educational experience specifically, there was a paper that was published in Radiology by Alvin et al. Last month that summarized some of the areas that are most heavily affected during the pandemic. And as I mentioned now, a lot of the residents are reading remotely, they're reading from home, and there is a change in the structure of how education is received. So most people are now doing the readouts either over the phone or over Zoom. And obviously there is variation in the quality and quantity of those readouts, depending on which services and divisions people are rotating in. And obviously this lack of uniformity is affecting training for many of the residents and fellows. There's certainly a change in the case mix. Obviously a lot of the elective procedures are now canceled, especially relevant for those of us in IR. Also will change the case mix that on the diagnostic side, residents and fellows are seeing. As I also mentioned, many of the residents and fellows have been redeployed to the clinical wards, and I'll talk a little bit more about that experience near the end of my slides. And but on the flip end of things, I think the radiology field in general has adapted in remarkable ways to try to accommodate what's happening. The didactic learning and really moving a lot of the lectures to Zoom, I think has been the biggest change that has happened for most of us in the last 6 weeks or so. And the APDR has also started bi-weekly conferences with access to national leaders in education which I know a lot of the residents and fellows have been taking advantage of. This has also been a very good time for research, given some of the downtime that the residents and fellows are having. I know here at MGH we have a medical student research group that has been very productive in the last 6 weeks and has been reaching out to residents, fellows, and faculty to publish papers. And I think we definitely have to mention the effect on the IR training, and specifically ESIR, as Dr. Bailey mentioned. And there has been some changes that have happened as a result of the pandemic, with some of the trainees being able to move some of their ICU rotations to happen during this period, but also there's a lot of anxiety about meeting all of the requirements that are needed for the pathway, and Dr. Bailey summarized very nicely some of the solutions around that. So there's no doubt that there has been a huge impact from the pandemic on resident and fellow education. With that, obviously, and all the anxiety that induces, there has been increasing focus on trainee wellness during the pandemic. And also in that same paper that I mentioned in radiology, they talked about a couple of different areas. Obviously, the social stressors are a big factor. The financial stressors are also another non-significant factor that people should keep in mind. So there has been a lot of different initiatives to address some of these issues. For example, in many of the residencies, there has been virtual trainee happy hours, and I'm showing here at the right side of the slide an example of a trainee happy hour that happened in the MGH residency that was put out on Twitter, and I'm showing here the tweet that says many much needed laughs, obviously during these stressful times. There is also has been access to online fitness and wellness classes by different GME offices across the US. I'm aware at least of 3 or 4 institutions that are offering such programming. There also has been an increased institutional support and resources to support childcare, and especially emergency childcare for all the residents and fellows that still might have to come in to the hospital. Also for us here at MGH, for example, they also gave access to hotel accommodations when the trainees are redeployed to the COVID floors to avoid them from spreading anything that they might contract to their families. And as I mentioned, now the move towards virtual fellowship and in some cases job interviews has helped a little bit with some of the stress that we're all feeling during this time. So I just want to switch gears a little bit and share some of the concerns that were compiled by the RSNA RFC over the last couple of weeks. The RSNA RFC polled its members and asked about how their training is being affected and some of the anxiety-provoking issues that are happening during this time. And I want to thank Courtney Raybon for sharing that feedback with me that was collected, and I was able to compile this list here. So the biggest issues that have come up, obviously resident redeployment and PPE shortages, which I'll talk about in the next few slides. The remote readout that I mentioned, and a little bit of the variation, excuse me, in the quality and quantity that residents are receiving during this time. There is also obviously the decreased case numbers. This is especially relevant for those of us in the one-year fellowships because we don't have obviously a lot of time to be able to get that clinical experience. This has been particularly, I know, an issue for those of us in IR who have had a decreased a number of procedures that we've been able to do over the last 6 weeks or so. Many of us have also lost elective rotations, specifically their electives for diagnostic radiology residents in or fellows in IR, and for those of us in IR, electives in vascular surgery or other similar electives. There's a lot of anxiety about potential delayed graduation, and I think Dr. Bailey addressed that a little bit and some of the requirements around that. Many of the graduating fellows are concerned about furloughs and salary adjustments for already secured offers. And for those who are graduating from residency going into fellowship, there's also a lot of anxiety about job market in the upcoming year. And I think this is certainly one of the bigger unknowns that we do not know what's going to happen this coming year. So just talking very briefly about the trainee redeployment experience, as Dr. Betty mentioned, most of us who were redeployed had a really phenomenal experience. For us here at MGH, we had DR and IR trainees assigned to specifically the medical wards for COVID. And there was a lot of support by the Department of Medicine, onboarding material that was provided to all of us at the elbow support while we were deployed to help us with EPIC or EHR to make sure we know how to put in the orders and write the notes, etc. There has also been, other than the medical wards, some IR trainees were assigned to mobile procedural teams for COVID patients. I know this is the case for some of the programs in New York. Also, some of the IR trainees were assigned to ICU rotations, and as I mentioned, that was used in some cases to satisfy the ICU training requirement for the IR residency. And specifically talking a little bit more about the redeployment experience. So there has been a number of articles that were published over the last couple of weeks sharing specifics about the redeployment experience. I did one article with the ACR on my personal experience, and just very briefly to summarize, for example, I covered nights, and I was caring for about 15 to 20 patients on the medical wards and doing a couple admissions per night. And I certainly had a lot of support, and it was really a phenomenal experience to be on the other side, actually reading both all the x-rays during the night of all the patients I was taking care of. So it was overall a very, very positive experience. And the last thing I want to talk about is obviously the impact on job opportunities, which is probably one of the more anxiety-provoking issues that some of the graduating fellows and residents are experiencing at this time. So there is a lot of uncertainty about secure job offers for graduating fellows. I have heard of a number of anecdotal reports from some of my friends across the country who are graduating this year that they are being told that they will have delayed start dates, rescinded offers. I know of at least one rescinded offer so far. And many people across the board are reporting decreased salaries compared to what they signed for in their contracts. So certainly the effect of this pandemic has introduced a lot of issues for those who have already secured jobs. And for the graduating residents specifically, they're going into an uncertain job market for next year. And the other issue that comes with this is the difficulty flying for job interviews and really seeing the practices that they're interested in if they get job interviews. So we hope that things hopefully will ease up and open up over the coming months. So by the time people start interviewing, this will be resolved. So looking ahead, I would say that adapting and living in a new normal for foreseeable future is going to be how we're going to deal with this for probably the next coming many months. And at this point, the true effect of the pandemic on trainee recruitment, education, and job opportunities, as Dr. Betty said, is really not well known. And hopefully the coming month will tell us more about what to expect. For now, as trainees, I think we can do our best and take advantage of all the new phenomenal available resources to refine our skills while we can. As I mentioned, the APDR bi-weekly educational webinars. There are many webinars available through subspecialty societies. Many programs are even making the resident conferences available to all. So there is definitely no shortage of didactic learning to benefit from during this period. For all the trainees also on this webinar, I highly recommend that you consider joining Twitter to virtually network with others in the field. I think at this point, with most of the in-person national meetings canceled, there is a missed opportunity there that maybe Twitter can come and substitute even partially for some of that. And certainly spend time with family and take care of your wellness. And I'll end with a quote by William Mayo: "The ills of today must not cloud the horizons of tomorrow." We will hopefully get through this. And with this, I will turn it back to Dr. Mossa-Basha.
Thank you so much to our three wonderful speakers and all their insight in regards to education and COVID-19. So we're going to go to a couple poll questions next. And please look at your chat panel to answer the following questions. The first question is, all residency interviews are strongly recommended to be conducted virtually. Do you think if a residency program were to conduct in-person interviews, it would have an unfair advantage? We'll give you a little bit of time to answer the question. So it looks like almost 80% of people feel that it would provide an unfair advantage for that residency program. Okay, we can go to the next question. Our university hospital residency program has withdrawn or reduced discretionary funds for meetings, travel, membership dues for the coming year? Yes or no? Has that happened at your residency or hospital? And we'll just give you a little more time to answer the question. And it looks like almost 65% of programs have had reduction in educational allowance funds. 60% now educational allowance funds have been cut. Thank you for answering those questions. Now we're going to go to the Q&A session, which includes questions from the audience and predetermined questions, which may include questions sourced from RSNA social media. So to start off, and this is to all the speakers, how do you see the fellow and job market changing over the next several years secondary to the pandemic? So going forward, what's going to happen to the job market?
I can probably start. I mean, I will say that right now, it's very hard to predict how the job market is going to rebound over the coming year. I think the biggest unknowns that we're all dealing with across all radiology departments is how is our volume going to rebound after now that all the radiology departments are looking at reopening. The hope is hopefully with all the departments reopening and we're all going to see an increase in volume, and that will open up more job opportunities for the graduating residents and fellows.
Hi, I think it is a worry right now when you've got budget losses in the hundreds of millions in multiple health systems across the country. I think if I were coming out today, I would be worried and I would be scared, frankly, about my position if I had a promised position. However, what do we know? We really don't know. So I think we've been through downturns before in radiology, and as a program director, my advice to residents was always the same. You've been competing all your life, go out there and compete for the best jobs you can get. And I don't know as an individual what else you can do.
Yeah, and the only thing I would add to that, we also don't know what the job force may look like. I mean, some of our very senior faculty may decide not to come back because the risks of coming back are high. So, you know, we see this in other fields. My wife's an OBGYN. Some of the senior partners in her group are not taking call anymore, not wanting to come back. So we will see how this plays out. We're hoping cautiously optimistic the volume goes back up, but the workforce demographic may also slightly change moving forward.
Wonderful. Thank you to all three of you for those responses. The next question is from the audience, from Emily Warnk, who is asking, has the ABR discussed the possibility of adding additional test dates or possibly offering a remote option?
I think I can answer that one. I spoke with the executive director for diagnostic radiology testing yesterday, Dr. Dunnick, and he stated to me that it's a moving target, that they do not have the technology to offer a remote option, but they're absolutely open to different dates and they expect they may have to do that. I would imagine, he did not say this, but it stands to reason to me that the testing facility is a finite size and you may have to double the number of dates in order fill them halfway instead of all the way. But I'm pretty confident they're going to be creative about this because they're trying to satisfy the candidate's needs.
Wonderful. Thank you, Janet. And the next question is from the audience as well, from Francis Deng, who asks, with interviews going all virtual, will there be a change in the volume of applications students will submit and the number of interviews each student will attend?
My personal view on that is we're still going to interview the same number of applicants because our process is going to take the same amount of time and the same amount of faculty resources. That's what my perception is going forward. I'm curious what others think.
I think there's a thought of it'll probably be easier to apply to programs in, without the travel issue, without the finances to get going with flying around the country oftentimes. It may be just a few more Zoom calls for most people. And so you may have a lot more people applying to a lot more programs from the applicant side. Again, I think on the department side, it's probably going to take the same amount of energy, but on the applicant side, I think it'll be less energy to apply to more programs in that way.
Wonderful. And the next question is from Rohini Nadgir, who's asking, any recommendations regarding incoming first-year radiology residents in July?
So I think this is something that I know our chief residents here have expressed concerns about, because I think the onboarding process is going to be very different for the first years who are coming in if we are still in that stage of remote reading during the July when they are onboarded. I think there are lots of concerns, and I think this is a time for us all to be creative about making sure that the incoming residents are included and really onboarded well, maybe in a different way than we've done it before, to allow this to be successful.
I had a couple thoughts about this. One thing, during this pandemic, we've all been distanced from each other. Many of us have worked in the same department for over 20 years, and we know each other very, very well. And we know our residents very well by the time this hit. That's not going to be the case with brand new residents. So I'm very concerned about it. And it's going to be an important consideration of how to make sure the incoming people, and you might have new faculty even, become part of your system, your family of radiology in your department. The one thing I would say is I hope we don't throw out the things we've learned through virtual techniques and things that have been good, but they don't replace the in-person relationships, in my opinion.
I totally agree. I do see Francis Deng on the QA and chat tool here, and I want to give a shout out to him because I listened to one of his webinars. He was on the ASNR webinar the other night, and I'll give you credit for this, Francis, because he said that we should not call it social distancing or socially distancing. It should be physically distancing because we still need to socially connect. So, even the terminology itself, I thought was really insightful, Francis. So I've carried that. But I think that's especially relevant for incoming residents. I mean, they sort of joined our departments in hopes of being connected with a bigger community. And we're coming in sort of swimming upstream with that community right now. So any ways we can be creative to make them feel connected, I think is very, very important.
Spencer Koch is asking, how are people actually checking resident cases out at their institutions? Still side by side with a mask across the room or using virtual connections?
I can briefly talk about our experience here at MGH. So for us here, it has been a combination of different readout formats. Most of the readouts are happening remotely, either by phone, I would say, or by Zoom. Obviously, Zoom carries a little bit of burden in terms of having to generate the link and sending it. But I think many of the people I've talked to have found a Zoom format probably a little bit more educational. But I will emphasize that I think the feedback that we received from the people I've talked to is probably the format should be a little bit different for junior residents compared to senior residents. I think senior residents are a little bit more comfortable with phone readouts and just someone just checking if the reads are okay and bring up some educational points, while for more junior residents, I think the Zoom format is probably a little bit more helpful to really walk through different findings and share screens, etc.
I think in our department, we have every method you can imagine, and all the different divisions and faculty are doing different things. And I feel so distanced from our residents that I was asking our program director, you know, how are they going? How are things going? And how do the residents feel about all these distant learning opportunities? And the program and our program, people want to be back in the reading room and they want to be together again. So, and I don't know if that's shared across every place, but, you know, telemedicine is great, but it doesn't replace being in the same room with your faculty.
Thank you. The next question, another question from Francis Dang. And this is for Dr. Bailey, what's the rationale for delaying the release of ARIS and the Dean's letter? It seems like programs will have less time than ever to review applications adequately.
Yeah, I actually wondered that same thing. So they don't specify in their executive summary, but if you read some of the more detailed stuff, they do say the rationale for doing that, the coalition recommendation, is that so many people haven't been able to finish all their rotations, and the assessments haven't been able to get done in the med schools to actually generate the dean's letters and do all of the preparation work for getting people graduated. So that was the main rationale. It's just taking longer because of the people being furloughed for such a long time, really 2 months.
And the next question is from Liliana Cynthia, who asks, are there any changes regarding the 4-year fellowship alternate pathway for IMGs?
I don't know the answer to that. I wonder if Mary Mahoney knows the answer to that.
Oh, no.
Okay, so nothing that we're aware of. And so Pablo Rodriguez Carnero is asking, in his department, they're doing most of their teaching sessions and conferences virtually using YouTube, Zoom, RSNA Diagnosis Live. He's wondering if there are any other useful resources and experiences that can be shared.
So I will just share that right now on Twitter, there is a Google form that's circulating that I think Dr. Betty mentioned very briefly. If you look under the hashtag FOAMRED, there is, I think, a 2 or 3 page Google Doc with a lot of educational resources, both from specific institutions or subspecialty societies that people can access, and they are organized by different subspecialties. So if anyone cannot find it, just find me on Twitter and I'll send you the link.
Yeah, I don't know if they can see my slide. I reposted the slide that I have that the bit.ly, that link that you see in that slide is the link to the Google Doc that Dr. Day is referring to. I don't know if they can see that slide, but yeah, so that's the link there that goes to the Google Doc. That's a very probably one of the best centralized sort of crowdsourcing resources that I've seen. Okay, great. So apparently you can download this in the resources tab also.
Okay, thank you guys. And Danya, I know you touched on this, but Jeff Klein, I was wondering how, if you want to provide any more input on how this has impacted interventional radiology resident training.
So, I mean, I will say that in IR, definitely we've been impacted quite a bit. I mean, similar to all the DR trainees as well, but most of the elective procedures that we do have been canceled or postponed. So the case mix that we're seeing is really more or less related to the COVID patients that are in the hospital. And I mean, I will say that because most IR divisions across the country also do not have negative pressure rooms, there has been a severe limitation to the number of cases that we can perform in our IR suites. So I think I would say that the impact has been really great, and we're trying to supplement our education with as many didactic resources as we can. But I will say for those of us who are graduating this year, there's going to be certainly some on-the-job training that will be happening when we start our jobs next year.
Thank you. And another question from Jeff Klein. What changes or innovations in radiology residency training will be maintained beyond the pandemic because they improve on the existing training processes?
Yeah, I mean, we have gotten that question a lot recently. You know, to use sort of the metaphor, I wonder if this era of online education is like the proverbial ventilator of education, and we're just going to come out on the other side and go back to the way we were, and this just bridges the gap of the COVID crisis. I'm not sure that's the case. I think, you know, as even Dr. Smetanopoulos said in his question, how much of this is going to continue in the future? I'd be interested to know what components of this trainees do want to have in the future. I think people have different ways of learning. We're discovering that more than ever now. Some people do like that in-person lecture. Some people like to learn independently. This may cater to both of those learning styles. Again, leveling the playing field from a resource perspective for programs and countries. There are, you know, the whole hashtag silver linings. There are some silver linings here potentially from the educational experience that we're having. So maybe it's not just that proverbial ventilator of education. It might be things that persist in the future. It would be interesting to know what components of this residents actually prefer or have enjoyed versus the old way. But I hope there is space for this or components of this moving forward in education.
And I think this could also be posed to Dr. Mahoney. Dr. Mahoney, do you have any thoughts on initiatives from the RSNA or from a leadership standpoint that will have a lasting impact on education in terms of programs developed?
I think that most of my answer would be more related to my own department than RSNA leadership. I agree with Harp. I think that we have almost a duty and an obligation to look at what we've done differently and what worked and didn't work. And this would be a huge waste of an opportunity if we just went back to business as usual and didn't really carefully go through the things that we've been through over the last 6-8 weeks and say, you know, there might be a better way to do this in the future. Certainly the RSNA board is looking long and hard at our meetings. So I think overall, all meetings are going to be different, not just local meetings in terms of conferences and virtual things that way, but all meetings. What purpose or role or how can we do meetings differently? So RSNA is definitely looking at how can we better meet the objectives and the needs of the membership through our meeting, which is such a huge part of what RSNA is. And are there roles for more online resources, more ways that we can reach the community that we haven't done differently? So both from that standpoint and my own department, I've already tasked my leadership team to say, let's take a long, hard look at this and let's think about how we might run our department a little bit differently in the future.
I just want to 100% agree with Mary and Harp on that. It is a wasted opportunity if we don't carry forward the things that worked. And Mary, you probably run faculty meetings. I bet you've never had so many attendees in your life as you've had on virtual faculty meetings.
Yeah, there's an awful lot of anxiety and curiosity. And so it's just not normal business. People are really interested. And I think the fact that it's, You know, it almost was not as acceptable just in terms of the culture to not show up in person. And now everybody's fine with just coming in on the computer. And those are some of the things I've thought about. And then also just the sheer volume of meetings. I think there are meetings that, at least in my institution, that are just on the schedule so we have them. And I think we need to look long and hard and say, is there really a purpose for this meeting? Is there really work that we need to get done, things we need to discuss, or are we just having it because it's the third Tuesday at noon and it's just time to have that meeting? So lots of things that we need to look at differently, not just in terms of residents but just overall operational issues.
I think we've had a similar experience where we are a very geographically dispersed institution with multiple sites across Western Washington. And during this time, in terms of attendance of education activities, of faculty meeting, of multidisciplinary conferences, our attendance has certainly drastically improved and been much more engaging.
Now, some might argue that's because we don't have as much work to do, but again, we need to look at it and decide what worked and what didn't. And a huge waste of an opportunity if we don't make some changes. Shame on us.
I think some might also argue that we want to see each other's living rooms and kitchens.
Yeah, that's been interesting.
And I do want to add a comment to the four-year ABR question that we had earlier. Donald Fleming indicates that there's no change to the four-year pathway, just to fill it in. And then another question from the audience from Patricia Rodriguez was in regards to the option for extending fellowships. And if anyone has any thoughts on that.
I mean, I can, I guess, start from a fellow's point of view. I know that many institutions at this point, excuse me, have said that graduations are going to be competency-based for the fellowships. And it's really up to the program director. I have not heard at this point of many program directors who are choosing to extend fellowship, but I think within what has been said through ACGME and Dr. Bailey, maybe you can comment more on that. It's a possibility.
I was on a call yesterday where this is being discussed in the surgery realm because they really need those numbers. So there is discussion about extending some people's training, especially in procedural specialties. That affects the trainees that are the new ones coming into the program in terms of numbers. So it's quite complicated and it's definitely not good, I would say, all the way around.
There's also the financial aspect to it. If you have extra bodies that you're employing.
And I think maybe we could squeeze in one last question for Danya. Do you know of any virtual hands-on resources for procedural training?
So I know that there are a number of videos that have been made available through some of the SIR channels. I think SIR RFS and the SIR medical student section have made some of those available, and they're also included in that FOMRAD Google Doc that Dr. Betty put up the link for. So those are the few I know of, and I'm sure there is probably a lot more out there.
I think we're out of time for the Q&A session.
All right, I think I'll wrap it up then for everyone. First of all, thank you, huge thank you to our faculty for sharing their expertise. I think it was a terrific session. Thanks to everyone online for attending today's webinar. And please make sure you check on the resources panel. There's details there on how you can obtain CME credit for this webinar. And I also just want to point out that RSNA has what's relatively new for us is called a community site. And I encourage you to continue this conversation on that community site. It's a great place where both you, your colleagues, RSNA leadership can comment, pose questions, and have them answered. And there's a link to that also on the chat and the resources panel. So terrific session. Thanks again to everybody, and stay safe. Have a great day. Thanks for being here.